Thyroid problems. Isn't it exciting? Or maybe not. But anyway, I find it exciting, so I'm putting out some videos of what's going on with the thyroid gland and what to do about it. And today's video is going to be simply what are the main causes of thyroid problems. Because it's one thing to know, it's a very good question, do I have a thyroid problem or not? If you do, then what is causing the thyroid problem? Then the next question would be, oh, okay, what do I do about that thing that's causing the thyroid problem? So we're just going through a series of questions here. The most common causes of thyroid problems I find are these. I find that food allergies and food sensitivities cause a ton of problems that affect the body in general. Very frequently, food allergies can be triggering some autoimmune responses that is making the thyroid a little crazy, and then it can lead towards Hashimoto's disease. So changing your diet, backing away from the foods that you're allergic to can reverse that and ease the burden on the body. So food allergy test would be good to run and see if you have some food allergies. And then you would avoid those foods. And there's some other things that we could get into with that. But in general, foods can be a big problem with thyroid disorders and stomach problems and heart problems and skin conditions and a lot of other stuff. But if you have a thyroid condition and the food allergies have not been tested for, you're not really having a thorough test to find out what to do, because changing your diet can totally change everything. Number two, hidden infections can cause thyroid disruption, can cause thyroid problems. Particularly viral type infections, I think, can attack and suppress and cause mischief with the thyroid gland. Low-grade infections in the stomach can also create chemicals that then get into the body, get into the blood, and then hit different parts of the body, sometimes the thyroid gland, sometimes just simply eliminating an infection that's causing a lot of inflammation in the body can let the thyroid start working again. So it's a simple fix. Get something in the stomach to repair, get rid of an infection that's in the stomach. Multiple things get better, including the thyroid gland can improve. So checking to see if you have some low-grade infections in the body would be a good thing to do to see if it may be affecting or suppressing or perhaps irritating the thyroid gland. Number three, nutritional deficiencies. That's a big deal. There's a lot of trace minerals that's needed that people just don't get, that the thyroid needs to function. I tell patients all the time that your thyroid is actually great, which is good news, but it's like a Ferrari. You've got this shiny red Ferrari and it's going nowhere because it's out of gasoline. Does that mean you need a new Ferrari? Does that mean you need to put your Ferrari onto a tow truck and have the tow truck drive it around town, which is what I call hormone replacement therapy? No, you just need to put some gasoline in your Ferrari and boom, you're gone, you're going. So you can be missing a mineral or a vitamin that your thyroid needs to function. If it doesn't have it, not going to be functioning very well. So logically, you would just need some extra of that vitamin or mineral and then see the function of the thyroid gland take off. The question is, what vitamin or mineral do you need? So it's good to try to test and find out what you're low on so that you can say, oh, I'm low on this, and I think if I take extra, that's helpful. So I find that a lot. And the fourth one is various toxins. So things like mercury, lead, arsenic, aluminum, various things that should not be in our bodies to a high degree. Sometimes they do get in our bodies. And then if they have an affinity for the thyroid gland, they can kind of shut it down. And so that does not mean that your thyroid is dead. That just means it's being suppressed. So you need to clean away these toxins, detoxify with some vitamins or some herbs, something that will help pull things out, and get away the stuff that's suppressing your thyroid, and it blossoms again. So those are the main four things. Food allergies, low-grade infections, nutritional deficiencies, and toxins. The ones that I find are the most common problems for thyroid are low-grade infections and food allergies and and nutritional deficiencies. I don't find that the toxins are as common, but pretty common. So, but I do find nutritional deficiencies a ton, that when you take an extra nutrient, your thyroid is just working great. And there are some people who genetically need a little bit more of a certain vitamin or mineral than your neighbor. Your neighbor has no thyroid problem, but you do, because you need extra of this mineral than your neighbor. So everybody's different. So running some simple tests can help us know what direction to take for helping your thyroid start to function better. Once we know there is a thyroid issue, what do you do about it? It's got to be coming from somewhere. It does not mean that your thyroid's dead. It's not. We just need to find out what is slowing down its function or what's making it hyperfunction. What can we do to get things to go back to normal? So there's some four approaches to that. So we'll run those tests if I meet you one day and you have a thyroid problem. Talk to you later. Please like this or share this or subscribe if you have a chance so that we can share these videos with more people and get some common sense approaches to thyroid problems. See you in another video.